Thank you for coming to the press conference. The Chief Executive will say a few words and then she'll take questions from the floor. Now I'll invite the Chief Executive to speak. Friends of the media, members of the public, in the past weekend, the epidemic overseas has become even more serious. And there is a large number of Hong Kong residents who are coming back to Hong Kong from these infected places. So we have seen a surge in the number of cases in Hong Kong. And also we have seen certain community transmission clusters. So following the principle we've adopted in responding quickly to the developments of the epidemic, we must now set up further measures to control the outbreak. We have 4 measures to announce today, or measures to announce for 4 aspects today. First, we are going to further prevent imported cases. We try to stop the transmission chain in Hong Kong coming from overseas. Here we have 4 measures. Starting from Wednesday, the 25th of March at midnight or at 00 hours, and it will be for 14 weekdays from now. For all Hong Kong residents arriving at Hong Kong from other places, all non-Hong Kong residents coming from other places arriving in Hong Kong, they will not be allowed entry. And for non-Hong Kong residents coming from Hong Kong, from Macau, Taiwan, if they've been to overseas within the 40 days upon arrival, they will be denied entry. And the Hong Kong International Airport will stop all transit services. That's the 3rd measure. 4th measure, for Hong Kong people coming from Macau, Taiwan, or for all travelers coming from Macau, Taiwan, including Hong Kong residents and non-Hong Kong residents, they will also be subject to compulsory quarantine for 14 days like for others. And then the second aspect of measures is we need to identify early asymptomatic cases. Now, as you know, for travelers coming by plane from other places, if they have a fever or other symptoms, the Port Health Division will refer these cases to the hospital authority. And then at the Asia World Expo and the North Lantau Hospital, the hospital authority has set up temporary testing centers. In the past few days, these centers have been operating well. So by doing tests, we try to detect travelers arriving in Hong Kong with symptoms that require referral to hospitals. That is, if they test positive, they will be sent to hospital, and if they test negative, then they will be subject to 14 days of compulsory home quarantine. Here, I'm talking about asymptomatic cases. So here, for these cases, they won't fall under the detection network of the testing centers. So for people coming from the UK and other parts of Europe, as well as the United States, for every arriving traveler, there is need to do a test. Well, as I said, that we're talking about a large number of people. So for every person arriving at Hong Kong, they must follow the instructions of the Department of Health to receive the test. The procedure is the same as that today. Well, it's just that only certain groups of people will be given specimen bottles, and they will have to return deep throat saliva specimen to the Department of Health for testing. But now we're extending the scope of such tests. So for everyone coming back from overseas, he or she will be given a specimen bottle. And then all arrivals will have to return the specimen bottle containing the deep throat saliva specimens to the designated clinic at a specified time. Later on at the media briefing of the Department of Health, probably you'll be given more information. Now, in the past few days, we have tested 143 samples. These are people with no symptoms, and the test results have all been negative. So you can see, therefore, there is indeed a difference between those with symptoms and those without. And the third aspect of measures, we are going to crack down even more severely on those that breach the quarantine order. Now, as at yesterday, we've carried out spot checks on those under compulsory quarantine order. We found that 5 have left their designated places, and some have actually even cut away or removed the wristbands. The police have already I located these 5 persons. The Department of Health is now assisting the police in carrying out investigation. Evidence will be collected so the Department of Justice could consider prosecution. And then these 5 persons have been sent to quarantine centers. In other words, they could no longer stay at home for compulsory quarantine. Instead, they have been sent to closed quarantine centers to complete their 14-day quarantine period. And then in other operations, police have found that 36 persons have left their homes without permission. The police have placed wanted orders on them, and they will try to locate these people. Now, you might note that there are some under quarantine orders who've left. Apparently, someone's playing a sports game at the peak. So the police are now trying to locate these people, and then they've been located, and then they will be sent to the quarantine centers too. If I may remind once again, for everyone under compulsory quarantine order, please don't try break the law, because you will have to show the legal consequences. Like this morning, there's a case, and that it doesn't involve someone who came back to Hong Kong from the at the airport, but it's a mainland, someone from coming back from the mainland, and that's that person is placed under quarantine center. A false address was given in the quarantine form, and the case appeared in court today, and the court does not allow any bail. So there are indeed illegal consequences. For people who breach the orders, as I said, we will tackle these cases severely. And the police have stepped up checks at different places, such as at restaurants and so on. And then we'll continue with our monitoring. The prosecution's division will also try to take these cases to the court as soon as possible. And in this respect, we are grateful to the people of Hong Kong. They are performing their civic duties. That's why through our hotline we've received reports from members of the public that people with the wristbands were spotted, somewhere. So we hope that to facilitate reporting from the public, we're going to set up a dedicated hotline very soon. The fourth aspect of work we're going to do is how we can further promote the reduction of social contact and gatherings. Recently, there's been discussion about people going to bars or gatherings, and we've seen confirmed cases. In fact, there are quite a number of them involving bars or gatherings at bars. Now, from the health authorities, we learned that at bars, the behavior is actually more high risk, because usually when you go to a restaurant, you could sit further apart, and then you you could distribute food. But then at bars, people sit close together to speak, or if they have a bit too much to drink, there may be even an intimate activity, behavior, and that will increase the risk of infection. So we are proposing, and we have to do this by a legislative exercise for all 88,600 places bars and clubs and restaurants covered by the liquor licenses. We are going to amend the legislation, and we will prohibit premises covered by liquor license to from serving alcohol. At the same time, with the restaurant trade, we will talk to them, and they could propose means to try to minimize the gatherings. For example, minimizing wedding banquets or celebration gatherings. And also, when people are having meals, they could propose ways to minimize infection risks. Now, so we rely on the trade to take certain initiatives, but if that proves to be ineffective, we may consider amending the relevant legislation. As we prohibit the serving of alcohol, we would also include a clause in this amendment exercise, so we have the powers to respond even more quickly in the light of the latest circumstances, and then we could impose further control on the operations of restaurants. For example, we could shorten the business hours, or we could limit the number of seats and so on. And the third point, as you know, there are many private clubs in Hong Kong. The SAR government will require that for private clubs under private recreational lease to stop operating recreation and sports facilities, changing room facilities, and children's play facilities. I hope they are already taking measures to avoid infection, because the Leisure and Cultural Service Department has already suspended these facilities previously, and they're doing it again now. Now, for these private clubs, if they have not taken any measures to prevent infection, we will write to them and require them to stop all recreation and sports facilities at the private clubs. Here, I would like to make an appeal to other clubs as well. That is, for clubs not under the private recreational leases, we hope that they will take the same measures. There are club facilities too in many private housing developments, so I strongly appeal to property management companies to take such prevention measures. For gyms operated by the private sector, I hope they will also take similar infection prevention measures. So today we would like to report to you the 4 aspects of measures we are going to take. In summary, if I may say that, we've seen rapid developments of the epidemic. In just a few months, we have been through various stages of the outbreak. Now, Hong Kong people have been working closely together, and we are, exercising self-discipline and our social behavior, and we have been successful in preventing an outbreak. Now, we have over 7 million people, but then we have, in comparison, we have a low percentage of infected cases compared to other places. We have not had any major outbreak either. So these are hard-earned achievements. Now we are seeing a large number of Hong Kong residents coming back, and we may be seeing changes. We've seen an increase in imported cases, and also perhaps because the public patience is wearing out. People can't take it anymore, so they have let down their guard a bit. In particular, in respect to keeping social distance. But I must remind you again, this war is still ongoing. This is a prolonged battle, so we need the cooperation of everyone. We are confident based on the experience we've had, and also because we've been staying highly alert, and we've been responding rapidly to changes, and we've been most transparent and open in explaining to you what we've been doing every day and how effective these measures have been. So we are confident we would win this war. Thank you.
Now to question time. Please put up your hand and ask through your microphone. And since we have the Department of Health press conference, we might be more concise, and please be concise with your questions. Just report it, please. Empire Daily News. Good afternoon, Chief Executive. You mentioned that on the banning the sale of alcohol, why so many experts have advocating on restricting the opening hours of the entertainment and food and beverage outlets. Why we decided not to do so? If you decide against it, we issue guidelines to them. For example, if you sit in single direction, restricting the number of seats. Have you been issuing these guidelines? If you take the legislation approach, and which ordinance would you invoke? And today you have a comprehensive ban of non-Hong Kong resident arrivals. And there have been a suggestion a few days ago. Is that you didn't do so? Thus, in the meantime, you have led to more confirmed cases. Are you actually behind? And should be expecting more draconian measures? Some experts have suggested that all the wedding banquets and wedding banquet venues have been guidelines issued to them. So what are these guidelines? Can you elaborate? Let me take the second question first. Over these 2 months, and every time I disclosed to the public on how we handle the epidemic, I stressed that we have to keep this in view and respond rapidly. And like I said, that this epidemic is unfolding rapidly. At the early stages, it imported to the mainland and now evolved to a globally. So for the new round of measures must be in accordance with the development. And please don't worry that for each time it's going to frequent as daily, or even each afternoon and the mornings, and depends on how they unfold in taking the most appropriate measures. And for each type of measures, we have announced right away and let you know it will be effective. On, for example, 19th of March, we have announced the mandatory quarantine requirement for all overseas arrivals. For non-Hong Kong residents, this has been very effective. As of now, the 19th to 22, we only have a few hundreds and stay at hundreds in the confirmed cases. As for whether it's early or too late, we have to gauge the effectiveness of these measures, and on that basis, we can enter the control. If you're interested in the numbers and the total number of confirmed cases, and excluding those figures announced at 4:30 has come at 318. And from what I know for now, for some, they were not able to determine is it non-Hong Kong or Hong Kong residents. For non-Hong Kong residents, 4. And that happened in these few days. Out of these 4 cases, on Saturday, I've cited one example which involved the spouse of one Hong Kong resident. And like I said, for the first measure, the target the ban of non-arrivals, arriving in Hong Kong. And for spouses, we may have the special arrangement to let them in. And as is a humanitarian grounds. And whether we more draconian measures, being closely monitoring the local situation and also that of overseas. This for what kind of measures will gain the support of the public in so long as there's a warranted in infection control and suits the Hong Kong circumstances, the government will not hesitate in taking forward these measures. As for the second question on the restaurant and banquet venues, I can say it affirmatively that the guidelines you claim for them to continue to operate, what kind of guidelines should be issued? This is already ongoing, and there will be a follow-up rigorously. And the Center for Health Prevention will issue such guideline clearly outlining that how they should operate. And like I said, the responsible department and also invite the policy secretaries to sit down with the sector, maybe through teleconferencing, and for what kind of work can be done in their respective sectors without resorting to a full closure of this food F&B establishment. Because a lot of Hong Kong residents don't cook at home. They need to go out to buy, or what about just take away but no dine-in? Well, we'll need to listen from the sector. Either for issuing guidelines or discussing with the sector or what other arrangements or options available that can be done. And for the legislative exercise, in terms of the liquor license, as for the liquor licensing authority, is a statutory body. Well, for this proposed restriction, that the banning of the sale and liquor of alcohol is very strict. Our view is that while the Secretary of Justice is still looking into it, they would like to invoke the Cap 99 on the Prevention and Control of Disease Ordinance to set up a new set of regulations. As you recall, in these 2 months, we had invoked this ordinance to set up 4 new regulations, enact 4 new regulations. So this will serve as a legal basis. Thank you. Next question.
Richard from TMHK. On the new border control measures, can you explain why you're doing this now? Why couldn't it have been done when you issued the red travel alerts earlier? And secondly, we've seen the pro-establishment and the pro-democracy camps call for this full border closure just today. Are you bowing to political pressure by agreeing to do this? And finally, on the changing the requirements for selling of alcohol, that could have a huge impact on people working in that industry. Will the government offer any sort of guarantees in terms of jobs and salaries, and how would that be enforced?
Well, thank you for the 2 questions. First of all, there are several regimes that we could resort to in ensuring the objective of reducing people flow, either from overseas countries or from the mainland. One is, of course, what you have mentioned, the travel alert, the red travel alert. But that's outbound. That's warning Hong Kong people not to go to these places. The second measure is, of course, the quarantine measure. That is for inbound travelers, arrivals, we impose certain quarantine arrangement, which will have a deterrent effect. So I have told you 2 experiences. On the 8th of February, when we imposed this 14-day quarantine arrangement on arrivals from mainland, we have seen a 90% drop in arrivals, whether it's Hong Kong residents or non-Hong Kong residents. And then on the 19th of March, when we introduced this 14-day quarantine arrangement at the airport, we saw a drastic drop in other visitors. But the Hong Kong residents returning had not seen a similar decrease, because a lot of Hong Kong people are rushing back because of the flu situation in the overseas countries. Now, the third measure is immigration policy. So under the immigration ordinance, we could impose requirements that's allowing people to come to Hong Kong for various reasons. So what I have mentioned today is using the immigration policy, that from Wednesday onwards, we will disallow non-Hong Kong residents coming from overseas countries arriving at the Hong Kong International Airport to enter Hong Kong. So you have to understand we have different regimes. And in the last 2 months in leading this fight against the virus, I have time and again emphasized we are basing our decisions on science, on facts and figures, on evidence, and also have the expert advice of the 4 professors on the expert advisory panel. Politics or pressure are not something that come into the formula, because it would be very risky to base public health decisions just because certain people have demanded for it. The difference between Saturday and today, one is, of course, the changing circumstances, which make people even more worried about these imported cases coming into Hong Kong. Secondly, we have to understand the impact of the measure imposed on the 19th of March and identified who are the people that, despite a 14-day quarantine, they were still coming into Hong Kong, so that when we deny entry, we know exactly who are the people to be affected and whether there are alternative ways to cater for the interests of these people. So there is this category, which I'll share with you. I explained on Saturday that amongst the 500 to 600 arrivals still coming into Hong Kong after the 14-day quarantine requirement, there was a large number of Macau residents, okay? Because you understand we are aviation hub, and a lot of Macau residents overseas, they have to come in through the Hong Kong International Airport, and they want to go back to Macau. The Macau government wants to welcome them back to Macau, even if they are coming back from a highly infectious place, because these are their people. So we have an agreement with, or understanding with the Macau government, that they will ask these Macau residents overseas to register with the Macau government. We will have the name list of these Macau residents. So upon arrival, we'll allow them to come in, and then immediately, they will not stay in Hong Kong. Immediately, the Macau government will send a coach to take them back to Macau via the Hong Kong to Hai Macau Bridge. So while I said that from Wednesday onwards, we will deny entry of non-Hong Kong residents, this special arrangement with Macau will continue. Because as far as we could gather from Macau, there are over 1,000 Macau residents still waiting to come back to Macau. So this is why I have to explain that sometimes there are certain decisions of a government will give rise to certain consequences. So it's much more prudent to understand the consequences of our policy decision and try to reduce the adverse consequences that will affect people or cause people hardship to a minimum. About what? The bars. Will there be any... Oh, okay. It's not just the bars. I'm afraid that many sectors, many enterprises are being severely hit by this coronavirus. Despite the fact that the government has rolled out a 30 billion package under the anti-epidemic fund and another $120 billion under the recent budget initiatives. I understand that there is this demand or aspiration for more support from the government. And on this occasion, when bars, or actually it's not just bars, it's all the restaurants and bars that have a liquor license will not be allowed to sell or supply liquor, certainly their business will be affected. We will certainly consider what further measures we should put in place to help these establishments.
Two more questions, please. On the second row there. I'm from the Apple Daily, Mrs. Lam. Now, you stressed that your anti-epidemic measures have been such that you've been responding quickly to the latest developments. But then the criticism has been it's always been too little, too late since the end of last year. And it's only just a few days ago you announced certain measures. How come just 2 days later you are now announcing further measures to ban non-Hong Kong residents from entering Hong Kong? Because Singapore was a step ahead of Hong Kong. Is it because you don't have enough vision? Or because you're just always late by a step? Now you say you will look at the developments for 14 days and then you'll make a decision again. So what would be the criteria for your assessment to decide whether you'll continue with this policy after 14 days? And then for entertainment venues, fitness centers, gyms, and so on, you say they should take their own initiative to carry out prevention measures. And then you said if such measures don't work, then there will be mandatory measures. So do you have to enact another piece of legislation or regulation? Or is it that under the current ordinance, it could cover these scenarios as well? So you don't need to enact a new piece of regulation in future. So in the current amendment exercise, it will be covered. Okay, that's about it. Now, in supporting businesses, would you give cash directly, like what UK does? They give cash to the employees. On the first question, I already said, and I'm happy to repeat it here. Now, in the last 2 months or so, we've been working hard to fight the epidemic. We've always been monitoring the developments in the epidemic. We've always had regard to the advice given by the experts. And we've always assessed the effectiveness of measures, and that's how we take things forward. So it doesn't mean that if I've said something today, I can't see you again tomorrow or the day after, because the circumstances are evolving rapidly, and by rapid response, it means that there's no time frame. It's not as if I'm only allowed to speak once a week. So I've always been, asking my team to stand by these three strategies. The first one is rapid response. As for the performance of the government in fighting the epidemic, well, I wouldn't give my assessment here, but all I can say is seeing what we've done so far, we are confident. We remain confident that with our healthcare system, with our dedicated healthcare staff, with the large number of civil servants and volunteers providing support, and then we have people in Hong Kong with a high sense of a high level of awareness to fight the disease, and then of course certain parents have to stay home to take care of children who are not going to school, and then some people may have to change their habits, and then there are businesses which have been hit because of the situation, but still we are all working closely together, and I am confident that we will be able to control the outbreak effectively. Now, for this denial of entry, it's immigration policy, so it does not involve any legislative amendment, and we don't want to give out a message as if we don't know because we don't know how long this will last. That's why I've said that we will review this entry denial policy after 14 days, and we'll see if there's justification for it to be continued. Of course, we won't wait till the end of the 14-day period. As I said, we're reviewing the situation every single day. And you know what I'm announced today, we didn't just think about it today, but rather after Saturday, when I met with you, we've been reviewing the situation, we've been considering other possible measures, and then seeing the developments, we believe there's a call for harsher measures. So that's why we're making this announcement today. As for the legislative amendment, the Department of Justice is still studying which is the best piece of regulation or legislation to use, because with the rapidly evolving circumstances, we may have to make any rules quickly. So that's why in the latest round of amendments exercise, the DOJ will have to find a way to provide an empowering clause. So in future, if there is need to respond rapidly to announce new measures or discontinue certain measures, there will be an authority designated to do so with the necessary powers. We've done that before. For example, when we enacted CAP 599C and 599E under CAP 5999, that is the mandatory quarantine measures. So who would decide who would be exempted? Well, that power has been given to the Secretary of Justice under the law. So that's something we are considering. And of course, we will make the announcement once the work is done. On employees, of course, if business don't do well, it's not just the employers who are affected, employees are affected too. Now, we've just announced a measure to ban the supply of alcohol on licensed premises. I hope no employees will be dismissed as a result, but then we will see what the government can do to give direct assistance to employees who are experiencing employment difficulties. Now, the Financial Secretary has announced the payout of $10,000 to all Hong Kong residents. Well, that's exactly something we want to do to help the public. But then for people unemployed or underemployed, I and the relevant government officials are looking into various measures. We'll do our very best to help Hong Kong residents, especially those whose employment is affected, and then we will give them suitable assistance. Thank you.
Last question. Cable news. You claim that the Secretary of Justice is still looking at the regulations, but it really issue can be going right away. So when is the earliest can you invoke the legislation to regulate the sale and supply of alcohol? And for Taiwan and Macau, for the arrivals from Macau and Taiwan, if they've been to the overseas in the 14 days, they would not be allowed in. Is there any way the Immigration Department can differentiate or know the whereabouts, only rely on their own declarations? And for the police spot checks where they found them not in the quarantined locations, there are quite a number of them. Had the government tried to come up with ways on how to boost the number of quarantine centers, we consider requisitioning hotels. If there are over 30 cases of those leaving their premises without permission, the actual number will be higher. I'll let the Secretary of Justice, Secretary for Security, to talk about the identification, and the Professor Chen will talk about the quarantine centers and explain why the hotel is not the ideal locations for quarantine. Let me talk about the formulation of the regulations. And for the restaurant and bars that are licensed to sell alcohol and prohibiting a certain time from selling and supplying of alcohol, that will require the legislative roach, because Hong Kong respect the rights of corporations. So this legislation exercise was beginning in earnest. I've talked to the Secretary of Justice, and while he is now taking it as soon as possible. And on the second point, we're discussing with the sectors. Besides the restaurant and bars, we'll need to talk to the bars. Rather than instead of need to, we can enact this early, because to allay the community fears that the bars will not become a venue for spreading the virus. While taking the legislative route, at the same time, we will take through consultation and also the detailed guidelines and so on in order to achieve a better outcome. And now pass on to this Secretary for Security to talk about those arrivals on the mainland and for Taiwan, but actually been overseas in the past 14 days. And thank you, Chief Executive. The Immigration Department, and for everyone all arrivals into Hong Kong, they will question them. If anyone providing false information to immigration officers, the maximum penalty imprisonment to 14 years for imprisonment. That's a very tough sentence. The Immigration Department colleagues are very professional and experienced. And also their questioning technique, and also they'll be provided with intelligence. As for the questioning of each arrival and on their performance and the information they provided, very often their information were not up to the satisfaction of immigration officers and denied entry. And so the Immigration Department can be professional in playing the gatekeeper role. And for anyone, if they provide false information to the Immigration Department, they will, the maximum penalty is 14 years imprisonment. Professor Sophia Chan. So you mentioned about the mandatory quarantine requirement. We noticed that certain individuals had not followed our instructions. Thus, the police have intercepted all 5 cases, and for the 30-plus cases, and we have found that they have left their dwelling place without permission and currently investigating. As for the, we will continue with this approach. As for turning hotels into quarantine centers, and for the new arrangement of the 19th of March, it is mainly a home quarantine. And hotels is also one of the options. We noted that a certain person under quarantine chose hotels, and quite a few hotels have arranged a quarantine package or assigned specific floors or have this 14-day quarantine arrangements in place. as I know that this is already happening. And for individuals who chose to complete their quarantine at hotels, as the Department of Health have been talking with the hotels and the Tourism Commission in issuing guidelines to let the sector to know of the proper handling and staff training and so on. The sector also point out that the hotels have discretion on implementing such arrangements. And we heard there are some concerns that whether there will be more testing for the hotel. And the CE have just mentioned that they would target arrivals from the Europe and UK and US, where all the arrivals will be required to undergo testing. And for the asymptomatic arrivals for the high-risk areas I mentioned, that each one of them will perform testing on them. Well, the current approach had already enhanced on the giving out of specimen containers, and we will give out more. And on this basis, we will keep reviewing. Because it has just started, we'll be reviewing the whole procedure after we handle the containers have been returned, and what are the testing results of the 130 containers hand back to all test negative. So, okay, the overall situation, we might adjust the testing strategy. This hoping to be more effective and get the results early. On the testing population size and for the testing of all arrivals, it will commence very soon. And finally, I have one final word. And to those who be on the front line of fighting this epidemic, and other government officers and hospital authority staff and all the facility medical this reports, I will send my deepest respect to them. This is a very challenging work, and due to the potential risk of infection, and those participating and their family members may have some concern as well. Well, they have been fighting the epidemic for over 2 months with perseverance. Due to some certain individuals are deliberately breaching the home quarantine order for ball games and could have a bowl of noodle, which may lead to community outbreak. I may ask, can you face this group of committed team? We had been successful in 2 months. On one hand, we've been preaching social distancing, for example, working at home and reducing social activities, and a halt of all cultural activities. We have been successful so that we can resume life to a certain degree to allow the restaurant to gain 20 to 20% of their patrons back. And due to the imported cases, however, we never ban Hong Kong residents coming home, whether we're coming from Europe and UK, and whether the cruise ship passengers from Japan or those Hong Kong residents stranded in Hubei. We welcome them with open arms. But while we welcome them home, we all have to follow the rules. If they don't obey the rules, they have to understand the negative impact so that we can fight this epidemic with one single heart. For those who plan to breach the home quarantine order, and for those who insist on going out and continued with their social activities, please give it a second thought. Couldn't you be patient for some time and let Hong Kong to win this battle. Thank you all.
記者會到呢度。
End of today's press conference. Thank you for coming.